wellness revolution starts now.
Welcome, I'm Dr. Steve Hotze. Thank you for joining us for today's program. We have a wonderful guest and a longtime friend of mine, Dr. Brian Hasslinger from Maryland, Western Maryland, near Cumberland. He's up in the mountains. As a matter of fact, he lives on top of a plateau in the western part of Maryland. That's at about 2,500 feet, which means he has cold winters and he has cool summers. So I've known Dr. Hasslinger since my days back in the Pan American Allergy Society. We both were active members of the Pan American Allergy Society, and I served as a president for a time, and so did Brian, and we served on the board, and we got to know each other well. Every year we'd have our conferences. So I wanted to bring him on today because he's an ear, nose, and throat surgeon, and he has a very illustrious career. He's been chief of surgery at several hospitals in Maryland, and he did a couple of years of surgery before he went into otolaryngology, which is ear, nose, and throat surgery and treatment. So I wanted to have him on because ear, nose, and throat surgeons, particularly Brian, have a different outlook on the way you treat allergy as opposed to conventional allergists. So Brian, tell us, when you got into ear, nose, and throat surgery, you probably were wanting to do a lot of surgery. How long did it take you to adopt the treatment of allergic disorders prior to them needing surgery?
So, as you said, I was primarily trained as a surgeon, and within 1 year of coming to Cumberland, it became clear that surgery could not effectively treat or cure all of the patients that I was treating. So, I developed. I started reaching out to various people and started taking courses in Pittsburgh, Kansas City, Jackson Hole. Eventually met Dr. John Boyles, at a meeting, and he let me know about
Pan American.
What's that?
Or about Pan American Allergy Society.
Pan American, yes. So then I started there in the mid-late 1990s. One of my first meetings there, which was at the Plaza San Antonio. It was a 4.5-day meeting, quite an intensive meeting. His nurse, Joanne Haley, sat me down and did provocation neutralization testing for food allergy. And little did I know that I had food allergies, and multiple food allergies that I did not recognize that had affected my health throughout my life. And from that, I was able to I learned inhalant allergy, but food allergy, and therefore I could help many more patients without surgery. In fact, I would say 80% of the people that I would have operated on, I didn't operate on. I treated their allergies and made them better. So, food allergies can manifest itself in any way, in any form, including inhalant symptoms, GI symptoms, psychological symptoms. And so if you can identify those early on, you can impact the patient's life tremendously.
Right. As you're well aware here, Brian, we started the Hotze Health and Wellness Center. It's strictly an allergy clinic. It's the way we started. And it was from the training that I received, too, through Pan American Allergy Society, Dr. Boyles, Dr. Willoughby, Dr. Dora Brown, and many of the other greats that taught us how to diagnose. I was in general practice prior to that, and I found out after going to the conference that most of the people that I had seen and were treating with various medications and cortisone shots and all that were really individuals that had allergic disorders. And if I could treat their underlying allergic disorder, I could solve a lot of their problems. So, and let me make it clear to everybody what an allergy is. An allergy is an abnormal reaction by your body's immune system to normally occurring substances in the environment. We think of the inhalant allergies, weed pollens, which are in the fall, tree pollens in spring, grass pollens late spring, early summer, year-round mold, particularly in the Gulf Coast area. Here in Houston, we say we're the mold capital of the world because it stays so hot and moist most of the year. And dust mites, mold spores, animal danders, all these can cause allergic disorders. Your body. I'm going to let you describe what happens so I don't dominate this conversation. I love to talk about allergies. And foods can also cause problems, folks. And the 6 big foods are wheat, corn, egg, milk, yeast, soybean. They're in all the processed foods. They can cause the same problems that inhaled allergies do. And allergy is a cumulative problem. So you may not, you think of your immune system like a bucket, and it gets filled up. And once it overflows, if you have allergic disorders, it overflows with allergens and you begin to have symptoms. But maybe in certain seasons, maybe in the dead of winter when there are no weed, tree, or grass pollens, maybe all you got is mold, but it doesn't fill up the bucket. So you can eat certain foods and say, I don't have a problem with them. Yet in the peak allergy season, that bucket's already full and you're reacting to the various foods and it fills up the bucket and overflows. So you can have unrecognized food allergies when you have inhaled allergies, and routinely they run together. So that gives you a brief overview of the way Dr. Hasslinger and I look at allergic disorders. So talk to us about the various symptoms and symptomatology that you were able to treat with allergy treatment, and what the path you took, how you started on allergy treatment, and what you're doing now to treat allergies.
So typically when a patient presents allergy symptoms, actually the most common symptom of allergy is fatigue. So the patient is tired, they don't sleep well, they're congested, they may have postnasal drip, itchy, watery eyes. These are all things that they can identify with. They may have recurrent sinusitis, facial pain. They may have esophageal reflux. Studies were done back in the 50s of dust mites actually draining in your mucus into the esophagus, causing esophageal reflux, eosinophilic esophagitis. People don't think of that anymore. Then, rashes, mold can cause rashes, different breakouts on your skin. Allergies can also cause a whole host of ear problems, itchy ear, ringing in the ear, headaches. And so when one comes in, you have to try to identify just what symptoms and through their history, what may be going on. Oftentimes an x-ray will help. They may have allergic fungal sinusitis. So it's often helpful to have some x-rays because they may be allergic to the substance that's actually growing in their sinus. They may have a yeast issue. They may have candida, toenail fungus, and so forth, and they may be allergic to that. So they're actually allergic to what's in their body. So they have a chronic reaction. So one has to look at all those aspects and then decide how to proceed. Oftentimes medicines, for instance, only treat 20 to 25% of the symptoms, and you're still left with 70% of the symptoms. So they feel better, but they don't feel good. So that's where testing comes in. Typically, skin testing is done. Typically, and in the day, the best way is endpoint titration, which is pretty much not done anymore because of insurance issues. So it's a modified prick test, an intradermal test on the skin. If one cannot have a skin test, then RAS testing, blood testing can be performed, but it is not as sensitive. And in fact, it's amazing how, the skin test will show reactivity and the blood test often shows no reactivity. So does that answer shortly?
Okay. So, and of course, you and I were both trained to do the intradermal endpoint titration, where we gave multiple skin tests at different dilutions of the various allergens, the weed, tree, grass pollens, dust mite, mold spore, and animal danders. And then we would do the neutralization test for the foods, where we give an injection of the food and see if it provokes a symptom at different dilutions and then try to neutralize it. So the big breakthrough, right now you're moving away from the intradermal testing, and what are you doing now?
Well, it's a modified test where we use the prick, and then based on that, we can only put certain numbers of intradermal tests on. The insurances, Medicare limits us. So if we're testing, that's what we use. I don't feel it's as good, but others would differ. But that's what we're left with.
So when you started treating for allergies, you, like me, started with injections.
So you're talking about treatment?
You were giving allergy injections weekly, right?
Okay, so as far as treatment, we perform subcutaneous immunotherapy. Typically, that was weekly. You would increase the dose every week unless there was a reaction until a maximal dose, whether it was a maximal tolerated dose or the maximal dose that one could give. Others would give what's called an optimal dose. So there are different endpoints of where that treatment would end depending on the patient response.
But it was injectable.
It was injectable.
That's what we did. And,
Right.
back in the society, Pan American Society, I remember back in the early 90s, some of our colleagues were saying, you need to try using sublingual allergy drops. Instead of giving a shot a week, give them their allergy shot basically as a sublingual solution, and to drop it under their tongues on a daily basis in low dose, and you could create the same effect. Now, I grew up as an allergy patient, so I took allergy injections from the McGovern Allergy Clinic here in Houston. While I was a kid, I used to give myself my own shots once a week. Well, I always thought, how could a drops be as good as a shot? And I'll tell you a quick story, Brian. Good friend of mine from high school had asthma every time during the fall, and he always got it when he went out deer hunting in the fall. That's when he had his big problems. And I told him, I said, Joe, come on in here. Let me get you on allergy treatment. And I came in and got him on allergy injections. And this is in 1995. And then in 1996, he calls me and goes, well, your allergy shots aren't working. And I checked and said, Joe, you're not taking them. You only taking them you got to take them year round. By then, I had already started using sublingual drops on young children instead of shots, which I had learned from our colleagues. I still didn't believe they would be as effective as a shot. But I told Joe, I said, Joe, get in here. Look, instead of taking shots, which you don't do regularly, I'm going to put you on drops. You just take these drops under your tongue every day and see how you do. Well, that was in July of 96. So I see him at a Christmas party that year. This would have been a Christmas of 1996. And I said, Joe, how are you doing? He goes, Hotze, these are Hotze's magic drops. I didn't have an asthma attack one this fall. And I came into the office the next day and I said to my staff, we're eliminating all shots. We're putting everybody on sublingual drops because it's, you don't have to drive into the office, sit here, wait an hour, take a shot or take them at home. People aren't compliant, aren't going to do as well. And Joe had done so well. I just said, if it worked for Joe, it's going to, and all my colleagues back there at the Pan American, and you remember how they were promoting that back then. And so I started him on the drops and everybody else on the drops. I only have one of our guests we had 1,500 allergy guests, patients, when I did strictly allergy. And only one of them continues to stay on the shots. And I asked him, I go, Ted, why do you stay on these shots? Why don't you take the drops? He said, I enjoy driving from downtown Houston out to your office and spending time out here and getting an opportunity to think. That's why I take the shot, but for no other good reason. I don't know what kind of results you had with your sublingual drops. How did they do?
So we have great results, and you're right. If a patient is not responding to the drops, it's because they're not taking them. And we
or the dose needs to be adjusted.
Right. But if they don't come back for a vial 3 months after it's due, they're not taking the drops.
Right.
So that's generally if they take the drops, they get better. And the the positive part of that is there's no side effects like the shots.
No side effects. I've never had a problem with anybody taking a sublingual drops for allergies that ever developed any kind of problem. And I did have some patients when they took the shot caused a problem.
Right.
That happened. I'm sure you've had, if you've had a large enough practice, you've had somebody took a shot and they broke out in a rash and, they got problems with it and you had to treat them. Now, it didn't happen. It was very infrequent, but it occurred. But you're not going to have that problem with the drops.
Yeah. So what's worse is you give the shot, the person runs home, they have Sears coming to check their refrigerator. They're cleaning out the back of the refrigerator, and they go into anaphylactic shock because they have double exposed themselves to a whopper dose of dust mite or dust.
Yeah.
So, luckily this fella, he came back to the office. My office was next to the hospital. We took him up and, treated him. He did fine. But the point is, we tell them you can't go run. You can't do sports that afternoon. You can't do anything that's going to raise your histamine levels. And so that's the headache with the shots. The drops, you don't have to worry.
Right.
So we put all our athletes on drops.
Yeah. And over the last several years, a new treatment has been developed called low-dose allergy immunotherapy or low-dose immunotherapy, LDIA or LDI, which we've incorporated into our practice here at the Hotze Health and Wellness Center, which, and explain to me, do you use LDA? And if you're using
we use LDA or LDI for foods and inhalants. So we have patients who have very severe foods and inhalant allergies. They're, they are rash ridden. We've proven, typically because they can't do skin testing, on a RAS test, and they may have 15 or 20 class 3, class 6 IgE sensitivities to foods, and just sky high, similarly with the inhalants. And so we've done that in these patients, and it has worked quite well. We've had no reactions. Now, other patients are slow to do that because there is some dietary limitation, or, they don't want to, hunker down and not be exposed to things. So there's some restrictions on that, and certain medicines they can't take. So try to tailor it to their needs.
I wanted to have you explain to our listening audience what causes the allergy reaction, what the mast cells have to do with it, what histamine has to do with it, why people take antihistamines. Why don't you just give us a brief overview of that so the people listening can understand what causes the allergic reaction in the mucous membranes?
So what happens is, and if you're an allergic person or an allergic potential person, you generally have it genetically predisposed to develop this reaction where you produce antibodies, IgE antibodies, which are circulating around in your body, and they are attached to various cells, mast cells in your nose. And generally what happens, let's say you're allergic to ragweed, and these antibodies are hooked to the mast cells in your nose. A pollen of ragweed, you breathe it in, it hooks to 2 of those molecules, and then it initiates an allergic cascade where the mast cell degranulates and releases other mediators, and then it's just like a chain reaction. And so they're additive. If you have multiple allergies, you have multiple releases of these degranulation events, and to the point that if you're allergic to ragweed and you have a bad ragweed season, you can actually prime up your allergies in the next season, which would be dust mites. So one year you may say, gosh, I wasn't sick last year like this. Why am I sick this year like this? Well, then you look back at the previous season, and then you say, oh, well, the ragweed was worse, and that's why I'm worse in dust mites. So the medicines that we use, there's different ones. So you have mast cell stabilizers, such as nasal chrome or cromolyn sodium. Antihistamines are histamine blockers. They're not antihistamines, they just block histamine. And if you have a lot of histamine, that's just knocking those antihistamines off. Then you have leukotriene inhibitors, which are, again, another part of the allergic cascade. and such as montelukast or singulair, and that's where that works. So,
well, you had mentioned when the mast cells have the antibodies, the IgG antibodies attached to them.
Right.
They when the allergen comes in, they capture that, and that causes the mast cells to rupture. And we say degranulate. That means they spill out their contents, basically.
That's correct.
And the content, a big content, is histamine. And that causes inflammation, swelling of the tissues, and you get all this drainage, and you get this clear drainage initially. That is a culture media for bacteria. And if your immune system's not strong, and it's not going to be, if you got allergies, your immune system's going to be overworked and worn down. Inevitably, it becomes a breeding ground for bacteria. Next thing you know, you have sinus infection, and then the sinus infection drains down into your lungs. Of course, you have mast cells all the way down into the bronchial tubes, and that all of a sudden it creates a extended problem. Now you got bronchitis, and maybe you get asthma and wheezing. And it all starts with that spilling of the histamine from the mast cells. So that's why most people, when they think of allergies, they think, if I'm going to treat my allergies, I'm going to go get an antihistamine. Like what? Like Benadryl or a Claritin or Zyrtex, or a number of them you can buy over the counter. Now, that's how people try to treat them, but that may cut back on the symptoms, but it doesn't solve the underlying allergic reaction. So explain what the treatment does with either the sublingual drops or the injections. What does that do to mitigate the allergic reaction? How does that work?
So how it works is you're actually giving a low dose of the antigen, either subcutaneously or sublingually, and it eventually, through various mechanisms, will make IgG antibodies, IgG4 antibodies, which are then blocking antibodies, which then will kind of capture the capture the antigenic stimulation. So it will block.
It's the allergens produce IgE, and when you take a small dose, you're producing an IgG. Is that correct?
Correct.
Okay.
That is correct.
So
sublingual
I misstated that
IgA
earlier.
antibodies too. So
yeah. So so you end up building up antibodies to block the allergens when you take allergy immunotherapy. You literally are immunizing yourself. And really, the first allergy conference I attended at Pan American Allergy, I turned to the doctor next to me and I said, you know what? If I follow this, I'm going to end up being a homeopath. Now, what does a homeopath believes? For every substance that causes a reaction in a person's body, whether it be a bacteria, virus, allergen, there's another dose of that substance in a lower amount that will neutralize it. So it seems really odd, and this is why most conventional doctors don't understand a thing about allergy. I didn't get a course on allergy one, I don't think, in medical school, except if somebody had an allergic reaction, how to treat somebody who had had a severe allergic reaction. You need to give them adrenaline, or, if they had a bad attack, or you give them steroids. But we were never taught about how to treat and to stop the allergic reactions from occurring. So it's in most physicians don't understand the whole concept, how like this, and it's probably to the common person, it goes like, I'm allergic to ragweed, but you're going to give me injections of ragweed. How does that work? Well, we give very low doses of ragweed or any of the other pollens, any of the other weed pollens that occur, or tree or grass pollens or molds. We give you a very low dose of that, and that's titrated based upon testing that's done, and that helps you build up blocking antibodies, and it works. And I know this because I built our practice on allergy, and it was like incredible. It was like night and day difference in treating individuals that had allergic disorders, treating them for allergies rather than giving them antibiotics and, steroids and prednisone and all that stuff. And antihistamines back then, when you couldn't buy them over the counter except for Benadryl, there was, we had a whole regimen you give people that had these various problems, which Drugs, as you well know, folks, are poisons. They're toxins. They have to be detoxified by the liver. If you detoxify something, you're detoxifying or you're neutralizing a toxin. Drugs are toxins. That means they're poisons. And they come with a host of side effects. All you have to do is watch TV, a drug commercial, and half the commercial about the drugs is listing all the terrible side effects that may occur. So allergy treatment today is very safe and it's very easy to do because it doesn't require you taking shots. And I don't know if the conventional allergists still use shots or not. Have they come to now? There are two types of allergies. There are allergists that come out of the ear, nose, and throat tradition, and that would be like Dr. Hasslinger and myself. We do ear, nose, and throat allergy treatment. So we have a different method of testing and a different method of treatment than conventional allergists, which really come out of internal medicine background. So it's a different type of testing. And we'd put our results up against theirs all day long, although they tend to denigrate what we do. I'm sure we denigrate what they do. We don't understand their method of treatment, and we feel like we have, and we know we have great results. Otherwise, you couldn't build a practice with 1,500 allergy patients in about 3 years, like I did. You couldn't build that if people weren't getting well. So the proof is, I like to say this, the proof is in the pudding. And you've developed a great practice up there in Cumberland, Maryland area. And God's been gracious to us. We have a wonderful practice here, which incorporates allergies. We started with allergies. Now, let me ask you one other question. And that has to do with the relationship between hormonal imbalances and allergy. What have you recognized about that?
Well, Steve, I'm going to defer that to you. I think you're a much better expert in that area. I mean, you've written the book on it, so I defer that to you.
Well, let me give a quick explanation since I brought up the topic. What I noticed in our patients that came in for treatment of allergies, I noticed two things in the women. Commonly, they had recurrent and chronic yeast infections. Why? Because they've been taking a potload of antibiotics for their sinus infections and for their bronchitis over the years. And the antibiotics, of course, will kill off normal, healthy bacteria in the colon, but they'll also kill off the healthy bacteria in the vagina, so they get yeast vaginitis. I can't tell you the number of women when I was in general practice, if you give me an antibiotic, you got to give me some monostat. Back then it was prescription item. You got to give me a monostat prescription. I always get a yeast infection on antibiotics. So I noticed that the women would commonly come in with allergic disorders. They had recurrent and chronic yeast infections. And that's when I read the book, The Yeast Connection by Dr. Crook, and learned that if you don't treat the underlying yeast disorder by a yeast-free eating program and nystatin and fluconazole, if you don't get rid of the yeast, they're going to still have the problem. So that's one thing I learned from women that had allergy problems. The second thing I learned, and it was very common, women would come in and say, I never had any allergies until I had my second baby. And ever since then, I've just been covered up with allergies all the time. And I heard this over and over again. And I'd say, well, go talk to your OB-GYN and see if they can get your hormones balanced. And it wasn't until I was introduced to natural bioidentical hormones and treatment with progesterone, particularly in women premenopausal, that we were able to resolve problems and control. Because when your hormones are out of balance, it adversely affects the immune system. Because your immune system, every cell in your body, has receptors for the hormones. When the hormones get out of balance, and ladies, you know it, you've experienced, you get the premenstrual symptoms. You get mood swings, fluid retention, weight gain, breast tenderness, headaches, sleeplessness, the whole 9 yards. And this occurs prior to the menstrual period. It's called premenstrual syndrome. And we found by simply adding progesterone days 15 through 28 in a routine 28-day menstrual cycle that we could dramatically control allergy symptoms. That it enabled us, not only we could treat them for allergies, but also just balancing out their hormones provided a tremendous benefit. So for those of you all that are experiencing, women that are experiencing allergic problems and they came on later in life, it can very commonly be related to an imbalance in your natural occurring hormones. And it's primarily the loss of progesterone deficiency, estrogen dominance, that leads to these problems that women experience as they march through their menstrual life up to menopause. So I wanted to throw that in. And Brian, tell us also very briefly, you had mentioned that you were concerned with the way this COVID played out. And tell me, what were your concerns about that, and what is your whole take on what happened starting in 2020?
Well, I can just give you a sort of a compendium of symptoms that I have been treating. It started actually before the vaccines with hearing loss and ringing in the ear. Following the vaccines, the first thing that I saw literally February of 2021 was the uptick of tinnitus. So tinnitus, which is ringing in the ears, there was a significant uptick. Following that, I started seeing sudden sensorineural hearing loss. And it used to be that I may see 3 in a year, like bona fide sensorineural loss. It's now at about 3 a day. So this has continued. Yeah.
And have you found that when you ask, did they get the COVID injection or not? Most of these people had received the injection?
So at first, it seemed that was the case. But now there's a second wave, and it appears that it's more both that have had the injection or had the COVID.
Right.
So that is another thing that we've noticed. So the hearing, dizziness, wishy-washy head, pressure in the ear, this is all part of the same thing. Following that, and to that end, the other thing that we noticed early on was these large cancers of the throat, tonsil, and they were, I thought, vaccine related, but then I started seeing a second wave of people who had cancer of the tongue, tonsil, mouth, nose, in the nose, that were not vaccinated. So,
and let me stop you there.
Yeah.
Compare this prior to 2020. Did you see them as commonly prior to 2020 or 2021 as you do now?
So, prior to 2020, it was rare to see an intranasal cancer. It was rare. You know, you had polyps, you had papillomas, but not squamous cancer in the nose. Typically, the tonsil cancers, the tongue cancers presented very small. Post 2020, I'm talking mega cancers. That's things I have never seen before.
And let me ask you, how much do you think it increased the number of cancers you're seeing? Was it 10% more, 50% more, double the amount of cancers?
I think it was double the amount. Yeah.
Well, that's a coincidence.
Well, I wonder if the COVID itself is not an oncogenic virus.
Right. Well, and I don't know whether you've looked into the whole concept of spreading of the virus. Sure. What are your insights into that?
Well, I had a lady who she came in with sudden hearing loss, and I asked her if she had just been vaccinated. She said no, but her husband was vaccinated 2 days earlier. And then there's stories like that when you get on an airplane and you get an arrhythmia while you're up in the air, or you around a crowd of people. So I can't explain it entirely, but it's enough people telling us that things are happening that cannot be explained. So I defer the actual mechanism. I don't know what it is, but it certainly seems odd that, when a woman who's not vaccinated gets around people that are vaccinated and they start having irregularity in their menstrual cycles, and there's too many.
Right.
If it were just sporadic, I'd say okay, but there's too many.
Right.
Then there's been the mast cell activation syndrome, which I think goes along with the allergy. So it seems like allergies are worse because the amount of histamine floating around in that bucket you talked about
Right.
are much higher, so that their threshold for having a reaction or having hives or a lot of food reactions. I've never seen so many food reactions. And so one of the things, and I can't explain it, maybe one of your listeners can shed some light on this, is that the incidence of IgG positive with beef, of all things. Every single person that we've tested, and we check, we're just trying to figure out what's going on with their hives or with their rash. And part of the workup may include a food test. Every one of them has elevated antibodies to beef. Can't explain that. Somebody, I'm sure, can, but
To beef, beef, not beets, beef.
moo.
There you go.
Yeah,
Okay.
beef. Yeah. So, we're seeing things that we've never seen before. Allergies are at times worse, I think. I think there is some breakthrough in the treatment because histamine levels are very high. So I encourage patients to take quercetin or quercetin and vitamin C. That seems to really help. Vitamin C helps to regenerate
Right.
the histamine degrading enzymes, diamine oxidase, and I think histamine transferase. I believe that's the one in the tissues. It seems to really help.
This is, folks. This is vitamin C, and
Yes.
Brian, you may or may not know I'm a big advocate of vitamin C. I'm a Linus Pauling fan.
I am too.
And when I listened to back in '89, I listened to him give a talk. It was taped. I think he was dead by that time, and he was taking like 30,000 milligrams a day, okay, orally, which is hard to imagine, but what I decided on, I said, this is my protocol. Now, I'm not saying all my providers here believe what I believe, but this is my protocol: 1,000 milligrams per 25 pounds of body weight. If you weigh 150 pounds, take 6,000 milligrams. You weigh 200 pounds, take 8,000. You can take it 3 in the morning or 4 in the morning, 3 at night, 4 at night. And also, if you have an allergy reaction, it is a natural antihistamine. It helps block the histamine reaction. So vitamin C is very, very important to have on board to help control your allergies. And if you're having allergies, double up on it. If you get loose stools, back off by a quarter. You can't overdose on vitamin C. As a matter of fact, in the treatment of cancer patients, those that practice alternative care to practice will give 60 to 100 to 120,000 milligrams of vitamin C IV. And routinely, once every couple of weeks, I'll tell them to bring in a vitamin C for me and give me 60,000 milligrams. Just run it in over 30 minutes. And it has wonderful effects on the immune system, also on your adrenal glands, because it concentrates about 100 times more in the adrenal gland than any other organ, and that's where you make your cortisol, which is important for your natural anti-inflammatory hormone. So vitamin C is very critical and very, very important. Listen, one other question I have for you, immunotherapies. Have you used that for mast cell syndrome?
I have heard about it, but I have not used it.
Okay, well, that's I'll get in. I
know.
I'll send you some information about that, because that is to those people that have mast cell syndrome. And remember, the mast cells are what rupture and degranulate and spill the histamine. It has been it's been added to the regimen for those individuals that have had the COVID shot and are having significant inflammatory symptoms due to that. And the immunotherapies has really dramatically helped them. That's what my providers tell me. So that's one thing. Let me ask you this. On those individuals that have taken the injection or are having symptoms, do you have a protocol that you use or recommend for your guests?
So if they have long COVID?
Yeah, long COVID, or they have post-vaccine problems.
Yes, I use a nutraceutical schedule. Oftentimes, it's based on the
Severely.
FLCCC, or
Yeah.
now they call Independent Medical Alliance. And we try certain nutraceuticals, low dose naltrexone.
Right.
Haven't gotten into methylene blue yet, but that's on the horizon. And of course, ivermectin is also an option. You have to be careful what you prescribe in certain states. So,
well, I know
that's another thing.
Right. It's interesting. Some states have it now over the counter, but I looked at the dose. For those people that think, well, good, they're going to make ivermectin fine over the counter, it's only 3 milligrams. That's the dose that they have. So you'd have to take minimally 4, 5, 6, 8, 10, depending upon your weight, because it's based upon your weight.
Right.
And we do use ivermectin routinely, with our guests that have long COVID. Plus, we use high doses of vitamin D, vitamin C. Many of them be on Melanox and some other nutraceuticals, quercetin and other natural anti-inflammatories.
AC.
Also, like glutathione and NAC, which helps regenerate the glutathione, and I think it also helps regenerate vitamin C. But anyway, there is a protocol, and for those of you that have any post-COVID injection symptoms, no matter what they are, you should be on a treatment program, hopefully to bind up the spike protein. That's what it's meant to do, and we're not sure. Hopefully, it will help eliminate the spike protein from your body, but we know that many people have been tested several years after they've received the injections, and they're still making the very spike protein that was caused by the COVID. But if they'd just gotten COVID and not a shot, they would have made antibodies and they had cleared it. But now they've got it in their genes, and they're making it over and over again in their ribosomes. So it's a dangerous problem. By the way, I wanted to mention one other thing. You had talked about the increase of cancers that you're seeing and allergic disorders that you're seeing and problems with ringing in the ears and dizziness and all that have come after the allergy shots. You know of Dr. McCullough. I guess everybody on this interview that's watching this interview, listeners, knows of Dr. Robert McCullough, who is the cardiologist out of the Dallas area. And he told me, you've heard about myocarditis, which is inflammation of the heart muscle. Now, you've heard of people, and they even admit it. Yeah, it's increased the risk a little bit of people that have myocarditis, but it's low grade. But they've even admitted it, the drug companies, that there is a certain percentage of people that have that. And you've seen them drop dead on the soccer field, on the baseball field, on the basketball field, keel over. They got myocarditis, and boom, they're gone. Well, Dr. McCullough, who's a cardiologist for the last 30 years, I asked him, I said, Dr. McCullough, you know about all the cases of myocarditis. How many myocarditis patients have you seen in your career over the last 30, 35 years? He said, Doctor, I've only seen 3 prior to 2020. 3 in my whole career. How many do you see now? He says, I see somewhere on the order of 6 a week, every week with myocarditis. And this is all correlated with the shot. Now, people say correlation doesn't mean causation, but something's going on. Well, Dr. Hasslinger, I appreciate you being on and giving us wonderful information today. Thank you for your longtime friendship. And thank you for the delicious honey that you sent my wife and I. It is absolutely delicious.
We will try to get you more.
I'd love to get some more. Thanks so much for joining us today. God bless you and your family.
Thanks so much. You too.
And thank each one of you for joining us today. If you have any questions about allergic disorders, don't hesitate to give us a call here at the Hotze Health and Wellness Center, and we'd be glad to evaluate you and treat you. God bless you now. Thanks for joining us.
At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physician's Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.